Hello and welcome to Office Hours, where I answer your questions about weight and weight medicine. I'm Dr. Meghan. I'm a board certified physician in internal medicine, lifestyle medicine, and obesity medicine. And this is really important because I actually prescribe these medications all the time. I actually talk to patients about their weight all the time. I've helped hundreds of patients lose weight, and I'm here to help you too. So if you're confused about your weight, if you have questions about weight medicines, and if you want medically based answers to your weight questions, you're in the right place. Welcome. So today we have another great set of questions for office hours, and because it's April, I'm doing YouTube shorts every single day. So if you have a question afterwards, you can leave it on this video, leave it on another video. I'll add it to the list, and I'm going to try to get through as many questions as possible in April. So let's get started. And as always, as a caveat, I can't answer personal medical questions because I'm not your personal doctor. So if your question leans a little bit more personal, I'm going to change it a little bit so it's more broadly educationally relevant to us all. First question, I would love more information on how to address having a non-alcoholic fatty liver on the GLP-1 medications. Okay, that is a great question. So, non-alcoholic fatty liver, it has a lot of iterations on that name, but basically non-alcohol based fatty liver is a really serious problem and one of the most common causes of liver failure in the US. There's really no broadly available treatment for it other than lifestyle modifications. I'm just going to back up a little on fatty liver. So basically, when people have non-alcoholic fatty liver, the fat builds up in the liver itself. And then after a while, all that inflammation and damage permanently damages the liver cells, and everything kind of shrinks down into this little, I like to think of it as like a little sponge. You know, like a sponge that's just been like really old and it doesn't really work very well anymore. It's just this little like very tough kind of thing. That's kind of what happens to your liver after enough time has gone by, after enough damage has occurred to the liver. So essentially, if we have a normal liver, then we have non-alcoholic fatty liver disease. It gets bigger and more inflamed, and then eventually it progresses to cirrhosis, and it gets very like fibrotic and it shrinks down, and then that's when people need a liver transplant because it doesn't really work anymore. And people have end-stage liver disease. So of course, we never want anybody to get to that point. And so what's the really interesting and appealing thing about GLP-1s now is they do seem to help resolve the liver damage in that kind of initial buildup phase, what we call steatohepatitis. So kind of where the fat is accumulating, but it's not it hasn't progressed to fibrosis. But there's also evidence that it might prevent progression to fibrosis. So there's the normal liver, there's the steatohepatitis phase where there's the fatty buildup phase. Then there's a fibrotic phase where that fatty buildup and inflammation starts to really permanently damage the liver. And then there's the cirrhosis phase where it all just kind of shrinks down, and that's end stage liver disease, liver cirrhosis. Liver is really not functioning well, and that's when people would be getting a liver transplant. So that's kind of the progression. And so what GLP-1s seem to be able to do is help when help treat the fatty buildup stage of the hepatitis, the fat accumulation stage, and then prevent progression to the fibrosis phase. So all of this is to say that if you have non-alcoholic fatty liver disease, it's really, really, really important to kind of buckle down and go full court press on the lifestyle modifications, because that is your best chance at preventing progression to fibrosis and then cirrhosis, which is end-stage liver disease. However, GLP-1s can also really be helpful. And of course, you have to talk to your physician about this and make sure it's right for you personally. But GLP-1s seem to really be helpful in correcting the fatty buildup part and then preventing the progression to the more advanced stages of fibrosis. So for anybody who is struggling with non-alcoholic fatty liver, definitely talk to your doctor, but I don't see why GLP-1s couldn't fit really well into a treatment plan for that for the right person. Okay, next question. Can GLP-1s help with slight alcoholism? That's a great question. Slight alcoholism, I'm not sure what you mean. There's many different ways to describe alcohol use issues. So basically, alcohol issues are really multifaceted and on, I would say, not just a spectrum, but there's many, they occur in many different ways. So some people have issues, they don't drink a lot, but then when they do drink, they have a lot of problems stopping. Some people don't drink a lot, but they drink every day, and maybe they're not realizing that their alcohol is just kind of too much for their body. And then there's some people who are, drinking all the time and can't stop and are going to have, withdrawal seizures if they stop. So there's many different ways to characterize alcohol issues. So I'm not quite sure what slight alcoholism means, but I'm guessing it's on the kind of, I'm guessing this is somebody that would be described as not on the, dependent concern for withdrawal issue, but more kind of like a problem drinking or problems with alcohol kind of category. And what I have seen and what a lot of my patients have seen and what a lot of you all have seen is that for some people on the GLP-1 medications, they do really tend to decrease the cravings that people have for alcohol. And I have a lot of patients who they're like, I don't even think about alcohol anymore. So that definitely happens for some people, and it doesn't happen for everybody. I definitely still have patients where, we have conversations about I think probably you should cut down on your drinking, and the GLP-1 doesn't really seem to affect them. But likely what happens for those that it does work well for is that it probably has to do with how the medications work in the reward circuitry system in the brain. And so in the process of turning down that idea of food as entertainment, there may be some cross reactivity with turning down alcohol as entertainment as well. Now, currently, these medications are not approved for any sort of use in addiction. Do I think that will change in the future? Definitely. If price was not a problem, if these medications were widely available and I had a patient who had alcohol issues, is this something that I would think about using at a small dose to see if it could help them? Yeah, probably. I think it's extremely effective in some people. So it's definitely, I think, going to be part of the future of these medications, and we're not there yet. And I think we would be seeing probably a lot more off-label use now if they were more affordable. Don't really have the bandwidth yet in terms of supply or cost yet to really try a lot of these things out, but I think it's certainly something that will be in the future for these medications. Next question. I have a bit of a different situation. I'm participating in our hospital's medical weight loss program. So taking Topiramate for the first 1 to 2 years and added Metformin the last year, and now just finally received a letter that I was approved for Zepbound, and the doctor says she plans on leaving me on both the Topiramate and the Metformin while on Zepbound. I'm somewhat nervous about side effects while on multiple medications, as there doesn't seem to be a plan to start Zepbound at a reduced rate or longer stages before going to a next higher level. Okay, great question. I think, if I had a patient that they're already doing well on Topiramate and Metformin, and then we get Zepbound approved, I would probably keep them on those doses too, on their oral medications, because they've brought them down to a certain level, and then the Zepbound can take them to the next level. So it's kind of like it's kind of the reverse of what normally happens, which is people are on the GLP-1 medication, it brings them down to one level. And then if I'm trying to get another, set of, decrease the amount of weight by a little bit more to try to see how, if the patient and I feel like their BMI is not quite in the safest place for them yet, then I would think about adding an oral medication. So for me, if I had a patient like this, I'm usually not going to take them off the oral medications if they're working well, because they've already taken them to a certain place, and then the Zepbound is just going to help kind of go the distance and hopefully get them to the the BMI that's really going to work the best for them. So definitely, I can see, so that's definitely just kind of the reverse of what normally happens, at least for on my end. And then of course, anytime somebody's on metformin and you're starting a GLP-1, I always want to make sure, like, I don't know, like could go fine, could go totally fine, especially if someone's tolerating the metformin already. The GLP-1s might not be a problem at all. And then definitely you want to work with your physician in terms of the right pace in terms of escalating. And you never know until you try, essentially. But you'd want to have good communication with your physician. And but yeah, keeping the oral medications is something I will usually do. Next question. I keep hearing from people in online communities that after having been on Zepbound 15 for a while, the medication no longer works for food noise or appetite suppression. Many are even talking about regaining weight while on the highest dose. This is alarming. I thought those who stayed on the meds maintained their weight loss. Yes, so great question. Typically, that is what the literature shows, is that people who stay on the meds keep their weight loss or even lose a little bit more. But certainly, what we don't hear about is if these little kind of urges or food noises comes back a little bit. And I think that can happen for some people. Their body just gets kind of used to it. But for a lot of people, like, they're so in tune to hearing it now that they know what it is, and it's a bit easier for them to kind of not be fooled by the food noise, be like, okay, I know what that is and I don't need to pay attention to it. This is also a really good point to bring up, is that if you are eating processed foods on these medications, like, don't do that, or try to eliminate it as much as possible, because processed foods are they're designed to kind of leave you wanting more. And so one way to really try to eliminate the food noise as much as possible is to decrease anything that might be adding to it as well. If you're eating processed foods on a GLP-1 medication, now is the time to try to phase them out as much as possible, because it's really not going to help with the elimination of food noise whatsoever. Also, it's sometimes when people get to maintenance, they kind of back off a little bit, or they loosen the reins, or they're like, yeah, I hit my goal, so now I can kind of relax. No, the whole goal of anything you're doing, any change you're making, is to keep making that change. And so it's not something you have to back off of or get relief from. It's just something that you keep doing over and over and over. So you need to make sure that you are staying really, really consistent with all your changes, not just the medication. So the short answer is, it's really not something that I am seeing. And usually anytime somebody comes in and they've gained weight on the highest dose, it's always been something else that's been going on. Like, they stopped exercising, they had a big family emergency and everything changed, and they were ordering takeout for a month or something like that. It's never been, I've been doing all the same things and I regained the weight. And that's also not what the literature shows. So clinically, that's what I've seen. That's what the research shows. And we'll certainly hear more about that as time goes on. But that is a great question. Thank you so much. That's going to do it for today. Thank you so much for watching. If you have questions afterwards, you can leave them down below. If you want to work with me directly, you definitely can. I work as a life coach to help people around the world with the non-medical aspects of their weight loss, which are a big part of making changes. So I'll leave all that information down below. Thank you so much for watching, and please be well.